Jessica DeMassa at the Guidewell Insights Lounge. I'm here at Singularity University's Exponential Medicine, and joining me right now is Dr. Jeffrey Rediger, and he is faculty at Harvard Medical School as well as a psychiatrist. So welcome, it's a pleasure to have
Thank
you.
you.
Tell me a little bit about the research that you're doing right now.
So what I do is I study people who got better when we don't think they should have been able to do so. I study people who recovered from medically untreatable medical illnesses, and try to understand the patterns that appear to exist across this large group of people. These are people who don't have a voice. You know, we study ultimate achievers in business, Steve Jobs. We study ultimate achievers in sports, Serena Williams, Michael Jordan. And yet in medicine, we don't study the ultimate achievers in health, and we should be, because there's a lot to learn. There's a lot that they have to teach us. We dismiss them by calling them anecdotes sometimes. I don't think Michael Jordan would, he's not an anecdote. Steve Jobs is not an anecdote. They worked really hard to figure out some things in their areas, and these people that I study have worked really, really hard, and they've figured out some things.
So what have they figured out? What have you learned from them?
So I've learned that there's a lot of factors to health. It's not just about biology. I've learned that health is social. Health is very interpersonal. Health has a lot to do with how we feel about ourselves in the world. I see a lot of times that people lose their will to live, or if they have a really strong will to live, they may say, I may have been diagnosed with breast cancer, I'm not going to die until I see my daughter walk down the aisle. And that can be a driving force for a person to attain a level of health and vitality that helps them surpass statistics.
Interesting.
So
is it a mind over matter issue?
Well, I think the truth is we in the West are very good at figuring out physical laws and physical principles. That's our specialty. That's our gift to the rest of the world. We have not really mapped the mind. There's always been a chasm between the mind and the body in modern medicine, and so the psychologists don't talk to the medical doctors and vice versa. And we send a person with a psychological problem to the therapist, we send a person with a physical problem to the physician, but the real key to health and vitality is understanding the way these things are interconnected and the person behind all of these different aspects, how they drive all this. And so that's a wilderness we've not mapped. And so when I talk to these people, I realize, wow, there's things here that we've never looked at. There's capacities for health and vitality that we would do well to understand.
So what should we be looking at then? What should we be looking at next?
Well, I think a couple of things. I think people who get well have made huge changes in their lives at every level. Lifestyle, they change the physiology and the biochemistry of their body, I think, because they will make deep changes in their lives, not only in terms of what they put into their body and all that lifestyle stuff, but they also make big changes psychologically. But these are superheroes of health, and not everybody can do that. What I'm really excited about, though, is that modern physics and technology are going to help drive changes that will make these kinds of things much more possible. It was a great thing. So I went to seminary before med school. And one of the things I had a chance to study at Princeton, it was a very exciting environment, was a lot of theology, philosophy of science, physics is very strong there. And to really begin understanding these, the way the world is shifting at the level of high ideas was very exciting. When I decided to go to med school then, I knew I was going to be in for a bit of a crash because modern medicine hasn't really gotten to quantum mechanics yet. We still have Newtonian physics driving a lot of it, but I knew the day would come, and that day is now here. And Singularity University and exponential medicine are a huge driving force to bring modern physics and technology into medicine. And so that's really exciting because it's going to change everything. It's going to empower patients. It's going to make us all in charge of our own health. Doctors will be important yet, but they'll be consultants. They won't be the expert on our lives and our bodies. We won't have sick care, we'll have genuine health care. We won't have reimbursement-based medicine, we'll have genuine evidence-based medicine, all of which doesn't exist as much as we would like to think right now.
Talk to me a little bit too about one of the trends that I've been noticing as people have been talking to me is really talking about how do you integrate mental health into all of this as well. So it's not even just integrating innovations and innovations from a technological standpoint, but innovations in thinking about mental health and how to bring it into the healthcare experience. So tell me what your thoughts are on that.
That's a great question. So that's a big topic. topic. And so one could talk about that all afternoon, drive you, you'll be exhausted.
No.
So one way to look at that is I think the psychiatry has an opportunity to stand back and look at the big picture.
Right.
Because when you see a person come into the hospital or into the office, we have all these specialists that treat the body organ, and then they walk out of the room, and no one really understands the stress the person is under, the stress that's driving the heart attack, the divorce that's driving the chronic headaches, the back pain that's from huge psychological burdens sometimes, and all the things that factor in. And there's an opportunity for psychology and psychiatry to stand back, see the big picture, see the person, and what the real story is. And my experience over and over again is that things don't really get better for the person in near the way that the person wishes or the healthcare team wish until we really understand the whole story here. So the story of what's going on for the person, for the patient, is huge. We often don't get the story. So psychiatry and psychology have a huge role to help with all of that. And you can't just have a psychologist come in and use their narrow silo or their blinders. They have to really stand back and see the big picture. That's a very different kind of psychology, to see the whole picture of things.
Well,
we look
forward to a future of care that definitely focuses more on integrating the mental as well as the physical aspects of health. So Dr. Rediger, thank you so much for joining us here and for sharing with us your perspective. We're happy to have you here at the Geibel Insights Lounge here at Exponential Medicine. I'm Jessica DeMassa. Thank you.